welcome. We've got a couple of minutes before we get started here, so everyone just hang tight and we will get going in just a couple minutes. I do have a fun poll question or unscientific poll question in the chat. What is everyone dressing up for this Halloween? Maybe it's not yourself, maybe it's your neighbors or your children or your nieces or cousins. I will share with you guys. My family has decided to do the Wicked theme. So my little one is going to be Glinda because, of course, she wants to wear the fancy princess dress, and then her brother is going to be the wizard, and I get the lovely treat of being Elphaba, the Wicked Witch of the West, and my husband is going to be one of the flying monkeys. So we really got
Amazing.
quite an interesting array of characters this Halloween.
You guys do it up every year. We'll have to wait for
I know,
pictures
right?
of
I'm like right now just really loving that my kids still want to dress up and sing together.
that.
So I'm gonna ride this train as long as I can.
My son is a blow-up shark, so that should be interesting. It's probably difficult to walk around in that, so we'll see how that works out.
I love it. Paul Donis here in the chat is saying that they're dressing up as the difference card. I love it.
Oh, wow.
You're gonna
Pretty
have
big.
to send some pictures my way. I wanna see these. Josh, do you dress up or just host trick-or-treaters that come by?
Yeah, trick-or-treaters. I'll put a clown wig or something on, sit out in the front yard, wait for them.
I love it. I love it. Well, keep dropping your costumes in the chat. Maybe you'll inspire Josh to do more than just a clown wig this year. But switching gears here, let's go ahead and get started. I am super excited to bring this webinar to you guys today. We are talking about the Broker's Playbook, navigating the healthcare affordability crisis for 2026 renewals. A little bit of a mouthful, but a very important topic. Couple of housekeeping issues. This is being recorded. I always get asked that question. So if you have to hop off early or a colleague wasn't able to join, we will make sure the recording gets sent around about 24 hours after the webinar ends. We have it locked down to where you can submit questions through the chat box or through Q&A. So please feel free to go ahead and submit those questions along to us as you think of them. We'll try to answer them as they come through. I think that's it. We've got a really big packed agenda, so we're going to go ahead and jump right in. All right, so for today's agenda, we're going to cover three main topics. One is understanding the current health insurance affordability landscape. Number two is exploring some plan design strategies that maybe can help combat these high renewals. And then number three, we want to leave you with some tips and suggestions for how you can win more business in Q4. So I am Taylor Britt, the Vice President of Marketing for the Difference Card. I will be your host today, and we've got two great speakers on as well. I'm going to pass it over to Josh.
Thanks, Taylor. I'm Josh Pyzik, Sales Director for our Midwest and West markets. So afternoon to everyone. Good morning if you're on the West Coast. I've been with the company for about 13 and a half years. So excited to talk about this playbook, talk about the difference card, and how we may be able to help in that strategy as you're speaking with your clients during what's probably going to be a pretty difficult renewal season. So Ashley and I'll help with that, but I'll let her introduce herself and we'll get right into it.
Great. Thanks, Josh. Hello, everyone. My name is Ashley Doobie. I am the East Coast Sales Director, so I work closely with our team from New England down to Florida, and I've been with the organization now for just about 11 years. Perfect. All right, so I'm going to kick it off here and just talk about understanding the affordability landscape. So it's no surprise to anyone on this call that health insurance costs have been rising at an exponential rate year over year. So in the past 10 years alone, the cost of health insurance has increased over 50%, essentially making it unaffordable. When you look at this chart to the right, a family premium in 2024 was almost $25,000. So showing no signs of slowing down, unfortunately. And then there's really a disparity between wages, where over the past 10 years, wages have only increased 27%. So certainly a major problem with health insurance. And from what we've seen on our team, there's pretty significant increases coming from 2026 at 20, 30, 40%. So today we're going to talk about unique solutions in order to help control healthcare costs while still delivering rich benefits to your employers. When we think about why health insurance costs are rising, there's a few different drivers here. The high cost service and drugs are still one of the main drivers. So GLP-1 drugs all over the news. There's certainly been a significant increase, and 79% of employers have reported that they've seen an increased utilization of these drugs. There's still also a mental health crisis going on. So 73% of employers have also seen increased use of behavioral health and substance services here. And then unfortunately, cancer is still around. I mean, certainly a high cost claim there that's also driving to the increase in premium. And when you think about the healthcare system too, I mean, there's also other things that are impacting the health insurance premiums. So anything on the labor cost side, from shortage with hospitals, physicians, nursing, that's certainly helping increase the cost of healthcare itself. Pharmacy inflation, so kind of related to the GLP-1s, where there's still a pretty significant increase in pharmacy costs that are leading to an increase in the health insurance premiums. And this, unfortunately, is forcing employers to think about traditional models where they're going to pass along costs to employees. So 51% of employers in 2026 are thinking about shifting costs to employees with higher deductibles or higher copays that they've seen in the past. And we're going to talk about solutions in order to avoid them from doing so.
But first, we are going to launch a poll question here because we're curious. Like, in your opinion, what is the single biggest driver of increases for 2026? Do you think it's the GLP-1 drugs? Is it those staffing shortages and supply chain issues that hang over from COVID? Is it major catastrophic claims? Or are people just using their health plans more? What are you, I know it's hard to pick just one, but in your opinion, what's the single biggest driver of this increase? Getting a lot of good answers here. We'll give everyone just a couple more minutes to submit their answer. All right, it looks like we've got a majority of you guys and you have voted. Let's check out our results here. So I think we kind of all saw this one coming, right? 47% of you said it's that pharmacy inflation and the GLP-1 drugs. Coming in second is the increased utilization of the health plans. Next, we've got catastrophic claims, and then only about 5% of you really feel that staffing shortages or supply chain issues are affecting this. So really interesting here to see these results. All right, well, we're going to explore some plan design strategies that maybe can help you with this. I saw a comment in the chat from Kevin that he just got a 42% increase for 11-1. So I'm going to pass it to Josh. He might have some solutions for you, Kevin, and kind of walk you through some options for renewals this year.
Yeah, thanks, Taylor and Kevin. We'd love to potentially take a look at that 42% increase. I was on a finalist meeting this morning, 39% increase, where our solution's able to get that down in the single digits. So that's what I'll talk about here a little bit, is our specific strategic solution at the difference card. And we kind of market this as a little miniature self-funded plan. So we sit in between that client that's fully insured or level funded today. They're experiencing increases. They stress the importance of having a rich plan to attract and retain and take care of their employees. And we can bring elements of self-funding, the good parts of it, like plan customization, data and reporting, stop loss protection, so a cap on exposure, down to that mid-size employer that's not quite ready yet to take the leap into fully self-funding. So it's kind of how we introduce this. And most of our clients that this is a fit for, they live on that MERP strategy for many, many years. I think is why we enjoy over a 90% client retention rate. Some clients, they kind of take this as a stepping stone into self-funding. So if you can think about how we're going to talk about the difference card and our medical expense reimbursement plan solution. Think about that client that maybe wants to get to self-funding, or they're paying too much in fully insured premium and they can take advantage of the elements of self-funding that we'll bring to the group. But conceptually, what we're talking about here is paying less money to the insurance carrier. I think we've got an example on a graph that shows a group that pays $1 million in fixed premium today. We want to buy down that plan. So we want to go back to that carrier, usually the same carrier, but really any carrier of choice. The difference card can sit alongside any carrier, any type of plan, PPO, HMO, HSA, EPO, whatever's appropriate for that group. And if it continues to be appropriate, let's don't change that. Let's not alter where the member goes and uses the plan, but let's pull back on fixed costs from the carrier. So that's our first step is, in this example, $1 million fixed cost spend to the carrier is reduced by 30% down to 700,000. And that savings that we get from that reduced premium bill from the carrier is what we're going to use to fuel our program. So again, a medical expense reimbursement plan that obviously has some administrative costs. It's going to have some claims costs. So when we say claims, it's the member typically using this card, so difference card, MasterCard. We can cap that liability through a reinsurance policy. So we can guarantee results ultimately. And our results on average are usually somewhere between 10 and 20% for the client overall. But in the same event, keeping the benefit plan rich for the employee. So that plan that they're enrolled in from the carrier, yeah, that may be an ugly plan, but the savings that they get from that premium comes in, fuels our card, gives back to the employee. So we obviously administer the plan, the employer sponsors it. The real beneficiaries are the members that now hold this card, and they don't feel a ton of difference from the plan design. So been doing this for a while, over 20 years. We've got over 1,500 clients across the country. Again, any market, all 50 states, any type of carrier or plan. And again, 90% client retention rate. So long-term clients, long-term solutions. And Ashley and I will both show you some case studies here that guarantee that first year savings, but then in subsequent years guarantee the savings, and we track that out, and we provide a 5-year projection for adopting this type of model versus again just doing it the old way and sending that premium off to the carrier and not really getting a peek behind the curtain. So that's the concept of the difference card, and really what we'll show you today is a strategic solution. Question, Taylor, I saw some questions popping up. Anything we should address now?
Yeah, I was just taking a look over here. Jessica did have a question on whether or not we would be provided information on how to get a quote during today's call. And
Yeah.
yes, Jessica will go through all of that. Just hang tight.
Awesome. So as I was going through that, you may say, well, this sounds like an HRA. And conceptually, yeah, it is. You buy less insurance, you set up a reimbursement plan to mitigate that. On an HRA, usually just a higher deductible. So HRAs are what we find pretty simple. Most administrators, carriers can administer an HRA. We like to think that we can take that concept to the next level and beyond. And you can do that because of a lot of flexibilities that are built into the MERT platform that don't really exist on a standard HRA. Big difference is let's buy one underlying carrier plan, lowest cost plan. So on the left-hand side here, think of that MERP or that carrier plan as like a $6,000, $7,000, $8,000 plan that we can then build off of. So we as the administrator can build multiple plans off of that one plan, still give employee choice in both that plan design and then the rate that they would pay. We issue a premium equivalent rate, and that's a differentiator as well. You can split cost on the MERP between employee and employer, whereas an HRA usually needs to be 100% employer only funded. So a lot of our CFOs that we work with, they like that they can take a contribution from the employee because the MERP is a big part of the overall cost and the plan design that the member experiences. So a couple of things there. And then I think our big differentiator, and Ashley will touch more on it, is the cap on liability. So this MERP 1, 2, and 3, it's going to have a liability associated with it of employees going out and using this card that the employer funds. But in the event that there's widespread usage of that, we can stop it. We can put a cap on that, and it essentially allows us to guarantee the results for every group from year one and into each year as they're renewing. So when we look at our card, that's what we issue to the employee. The spouse gets one, the kids are tied to both cards. We're not secondary insurance. It's not like a gap plan where you say, oh, here's my Blue Cross card and then here's another ID card. No, we're a payment mechanism on top of your major medical plan. So we can align this card in dozens of ways. This is an example of a group that likes their copay. They want to keep a copay plan in place. But you don't buy the low copay plan or the low deductible plan. That comes with high premium. We go back to the string grid of that carrier. We buy down on that plan. And when you do that, when you raise the deductible and you change the co-insurance, usually those copays are going to change within that plan as well. So all of those differences within this plan on the bottom that you're now enrolling your employees into can be mitigated by the use of this card. So we've got the technology to go in and say, I'm at a doctor, I can work for this amount. I'm at a or emergency room, I can work for this amount. I'm at a pharmacy and I'm buying prescriptions only. So it's like a gift card, right? And in this scenario, you hold this card, you want to swipe it first, and then if there's any out-of-pocket costs that are left over, that's what you would pay to complete that transaction. We also administer Flex, so you could put a flexible spending account on this card, and then it would work in conjunction with that one swipe to cover that out-of-pocket cost for the member. But you can now think of this as really like a tool to dissect that plan that you're using from the carrier that comes with low premium and then ultimately only paying for these incidental visits as they're incurred and as the members are using. So that's how the whole thing works. We get a decrement from the carrier, we give back when needed, and then we cap the liability if in fact there's more usage than our maximums have been set up. Put that sticker on the card. So part of this is education, right? There's two sides we're going to talk about. When we're proposing this to the finance side and to the HR side, the numbers have to work, and that's going to be proved out through the carrier decreases in our underwriting. And then we have to think about the people aspect of this, how we're going to use this card, how we're going to educate, and we provide a ton of support there. At the end of the day, you've gone through our process of education. You remember you have this card, you reference the sticker that we're going to provide that goes on your card that tells you where you can use it and for how much. And it'll really help remind that member, it'll help the provider. And we want to make this as easy as we possibly can.
And Josh, before you move on to the next slide, I do have a couple questions that came
Sure.
in. Someone's asking, do MERPs work with both fully insured and self-funded plans?
Self-funded plan, yeah, I mean, it's more on the fully insured or level funded side that's being managed by a carrier. We do have some self-funded clients that still take advantage of the MERP and the technology that we have with the card and the ability to put an FSA or an HSA on the card. Typically, we're targeting this to that group that's fully insured or level funded today, and they kind of want to take that to the next level without making that final leap to true self-funded.
Sure, sure. Great. Thank you, Josh. And then finally, if you could speak a little bit more, I'm sure the next slide will kind of go into this, but we have someone wanting a little bit more information on how the buying down of the insurance plan works.
Yeah.
And I think if we could explain that, that would be great.
Sure, yeah, we're gonna change the plan design, but we're not gonna usually change your carrier. We're gonna change the network. So think about your renewal packets that have all of those options in them that the group could choose to purchase. Well, we're going to use usually the bottom plan that comes with that lowest premium, and then we're going to attach our product to it to get back up to the level. So yeah, I think Taylor on the next slide, it's going to, probably help us walk through when we actually quote a group. Well, we're going to be asking for minimal information. It's really the rates and the plan designs and the enrollment counts. But that's how we get started. So we want to establish that baseline cost of the renewal. Right, so 1.2 million paid for current. In this group, this is kind of an anomaly. We're not seeing many 3% or single digit increases out there, but it can still work for that group that's getting still a palatable increase. But at 3%, they go up to 1.3. Group came to us, broker came to us and said, I want to show my client something strategic and unique, and I want to try and get them below current, even with a good renewal. That's where we get started. So this revised fixed cost line now represents that buy down, right? So we map the employees into that new lower cost plan, and we need to represent what their fixed costs are. So fixed costs are now pay the carrier for that lower cost, higher deductible plan, and pay the difference card our fixed fee. So our interest in the group is a per employee per month administration fee that includes that reinsurance premium. So to keep everyone enrolled in the carrier and to keep an active difference card, that fixed cost is going to be required for this client. We then underwrite based on the liability and the benefit that we're giving on this card, and we can set that at a maximum. So that's kind of the beauty of this is we've got that protection set through Assurant. We can make this real easy. We can say no matter what the actual utilization of this card, you're capped at 1.22 million, and you are guaranteeing you a 6% decrease from current. Uh, so, an HRA that doesn't have that protection built in there, you can project and you can estimate, but you can't set that maximum. You can't set that guarantee. And with all of our clients that elect that reinsurance, they can now, budget and fund to that maximum and know exactly what the results are going to be out of the plan. Now, it could be better. There's nothing in here that says they have to spend all of the 1.2 million that's been pushed into the plan. Most of our clients at the end of the year would have some level of reserve setting in their dedicated client-owned bank account that holds a claims reserve that they fund in once per month. And then in that event, they would get those monies back in addition to their guaranteed savings here 100% at the end of the plan year. 60 days at the end of the plan year, any reserves left in their difference card account is going to go back to them 100%. So this is what we'll quote, we'll strategize what's the goal of the client, what do they want to accomplish as far as savings and plan design, and we can tweak this and we can be real customizable. And that's what we love to do as sales reps here at Difference Card is to get in and dig in and figure out the best way to bring to light our capabilities in our platform and provide those results financially, and then usually the same or better experience for the member on the plan. We do show that 5-year projection. So this is just a representation of let's lower those monies given to the carrier and expect a renewal increase year over year, right? We're probably not going to be able to alleviate that completely, but that top line number compounded at 9% over 5 years versus that bottom line number at that same increase, it's providing some pretty substantial results on a 5-year plan. And then we have to do this each year. We have to renew. We have to show the guaranteed results, and then we're going to build this in and show that this is, continues to work for our groups and that it's a trajectory for a lot of savings year over year. So that's it for the copay plan strategy. We do have other strategies. Ashley's going to cover one, and then we're going to come back and talk about how we can, talk to different types of folks within a particular group and hopefully get them interested in a solution like this.
Great. Thanks, Josh. So I'm going to talk about a little bit of a different strategy that we've been taking advantage of recently. Just instead of staying in that copay environment, moving to a higher deductible and offering the employee a bucket of money for the MERP. And this has worked out really well from an employee education standpoint where it's easy to understand. So on the left-hand side here, we have a group's current plan. Once again, rich plan, $30 copays, $1,000 deductible. This is a great plan, but they're paying a lot of money in insurance premium to deliver this plan to their employees. So we worked with the broker. We priced out this plan in the middle, the $6,000 high deductible. And in most markets, we're receiving really good decrements on some of these higher deductible plans versus staying in a copay environment. So by buying that $6,000 deductible, we were able to drive down the health insurance premium monthly. And that's where the Difference Card MERP comes in. And how we structured this plan design is that we also significantly improved benefits for employees. This was a nonprofit, so this is something that was really important to them to deliver rich benefits as their employees were not highly compensated. So we set up this MERP to have the first $5,000 worth of all medical and prescription drug services covered by the MERP, and the employee would not have any cost share until the back end 1,000. So this is very well received at the open enrollment meetings where the employees have this card. They can swipe it for any type of office visits, prescription drugs, any other copays, and it's being covered by their employer. So this is a great way that the employer found to attract and retain employees by offering this very rich benefit plan that you can't even replicate from an insurance carrier. In terms of the financial piece of this group was hit with a pretty significant increase for 1/1. Their current costs were 1.9. They were looking at almost a 20% increase here on their existing plan for their cost to increase to 2.3 million. We then worked with the broker, priced out that $6,000 deductible plan, added in the difference card service premium, and brought their fixed cost down to 1.8. We then added in the maximum claims cost, and that brought their costs up to 1.9. So what we told this client, instead of a 20% increase, you're actually getting a little bit below flat. And guaranteed savings versus renewing as is about $397,000. So this was really attracted to this group where they knew their worst case was a flat renewal or slightly under flat. And then there was upside potential if the plan ran better than we expected, that there was additional savings on the table. Once again, as Josh mentioned, CFOs love this slide where we just talk about a cost saving strategy over multiple years. As I mentioned before, the cost of health insurance aren't slowing down. We need to find a way to decrease really the premiums that we're getting from the health insurance carriers, or employers are getting from the health insurance carriers. So the effects of compounding comes into play, where if we're discounting the premium by 30%, that even if they get a renewal increase the following year, it's on a much lower number. So what we told this nonprofit that over 5 years, we're going to save them $2.3 million off their health insurance spend. So the difference guarantee, we've had this product since 2018. I remember when I was selling, I would go back out to an employer before we had this product and I'd say, hey, here's what we think is going to happen. And I was challenged by a lot of CFOs that say, okay, what if every single employee hit that $5,000, $6,000 deductible? So adding the difference guarantee where we can offer them a cap on the claims piece has been really attractive. And we have the ability to do that either a cap on the monthly claims or on an annual basis. And we partner with an A-rated division of Assurant to offer that difference guarantee.
Yeah, thanks, Ashley. Before we jump into our second poll question here, I do have a couple of questions that have come in while you were speaking. One of them is they just want a little bit more clarity on how the difference card works exactly. They're saying, just to be clear, the difference card is not negotiating prices, just encouraging the employer to take a cheaper plan and supplement with the difference card. Can you speak to that a little bit more?
Sure. So our product is sold through insurance brokers. So traditionally, if you have a client that's maybe getting a 30% increase, that's a great fit for the difference card. We normally look at their current plans and have a strategy discussion on what's important to this employer. We'll then work with you. We really know which carriers have the best plans and the best decrements on the strategy that we're going with. So if we're going to that high deductible, for example, we'll tell you the plan design as a broker to go back out and price that with the insurance carrier. So really the whole process and negotiation between the broker and the carrier is on that pricing for those bronze plans that we are ultimately recommending that the employer purchase to drive their health insurance premium down.
Wonderful. Thank you, Ashley. All right, let's get into this poll question here. So we're just curious, in the past 12 months, how many of your clients have requested alternative funding options? It doesn't have to be the difference card MERP strategy that we're talking about here, but are you seeing a true need in the market for something other than just out of the box standard renewals? Maybe 5 to 10% of your clients, 10 to 20, 30 to 50, or are over half of your clients needing something different to meet these high renewals? Give everyone just a couple more seconds to cast their votes. All right, let's go ahead and take a look at what we've got here. So really kind of a mixed bag, spread pretty evenly, with 10 to 20% of clients requesting an alternative funding design. Some 30 to 50% of you guys are seeing it. So you can tell there's a need here from these results. And I think that I would agree. I know Josh and Ashley, you guys probably would, that you're seeing this as well. All right, well, I'm going to keep going and talk a little bit about ways that we can support you. So A broker playbook is what we're calling it. It's football season. Everyone's got these plays that they are running to be successful this year. And we want to make sure that you guys are successful as well. So I'm going to go into a couple of things that we recommend brokers do to have successful conversations this Q4. So we came up with 4 questions that we think you should always ask during a renewal prep conversation. Number one being, when you're speaking with a client, what is your top priority for this renewal? Is it cost savings? Is it employee retention? Are you having a hard time attracting new talent? Or maybe it's just plan stability. You want things to stay as consistent as possible so that we're not rocking the boat. That's number one. Number two is getting a little bit deeper into how are rising healthcare costs affecting your overall business? Are you having to lay off employees? Are you having to like not hire as many? Like, what is it? How is this affecting you? And then third, what level of risk tolerance does their organization have for considering something different, an alternative funding or plan design alterations? Are they open to something like this? And then finally, how would they define a successful benefit program, both from the leadership perspective and from how the employees perceive the plan? Josh, do you have any thoughts on why these questions are important to ask?
Yeah, these all really resonate just with the number of client finalists that we're involved in. And if you haven't worked with us in the past, just know that your senior consultant would love to help you get our solution proposed directly to a prospect or to one of your clients. But I think to address number one, like what are the priorities here? Probably depends on who you're talking to within the group. The finance side, particularly with high renewals this year, they're looking for a way to mitigate those renewals. And I think the difference card is a good solution for that. You talk to HR, well, they don't want a big disruption, right? They're overworked and understaffed in most scenarios, and you throw something new at the employee, and there's now more knocks on the door than they had, and they already had too many to begin with. So, I think our product can help with that and help address both of those concerns. Rising healthcare costs, obviously, if we can pay less to the insurance company, we can bring in a product that doesn't disrupt the employees, can certainly help with that. And then our reinsurance with the risk mitigation, it just gets a lot of clients into a platform like this that is really effective that they've maybe shied away from in the past. Like you've probably talked to your groups or your prospects about an HRA in the past. Well, okay, maybe it didn't bring the results that you wanted, and maybe it was a little too much risk and it just wasn't a fit. Well, we can kind of take that to the next level. We can cap that risk and guarantee our results. And so it's just really what defines a good renewal. It's usually a low or no increase, which we're just not experiencing in this market. And it's not a big change for the employees. And so we may not be able to wipe out completely a 30% increase, maybe bring that down to 10 or 5 or 10% increase. But what we can usually always do is keep that carrier in place, keep your network and your doctors and your hospitals and your pharmacies, not bring in that disruption to the employee, and then give them the same or better benefits. So I think when you're having these, when you're asking these questions, you're having these conversations, think about your difference card sales rep. And if you don't know who they are, we'll tell you who to get in contact with. But we can usually, for that fully insured or level funded client that has these concerns, we can usually show them something that will kind of hit on all those bullet points and potentially bring them some good results.
Yeah, agree, Josh. I mean, I think the real point here is just asking better questions could really uncover the real problems and not just maybe that budget line item. I think that's, the key takeaway that we've got here. Next is tailoring your conversations for the audience that you're speaking with. Josh kind of touched on this previously, but we just wanted to provide you some guidance that we've seen work really well. And it's when you have executives in the room, you're going to want to focus on that financial predictability, return on investment, and long-term cost control. If you've got HR leaders in the room, you're going to want to emphasize employee engagement, talent retention, ease of administration. How is this going to, make their life easier? And then if we've got benefit admins available, we want to talk about the affordability aspect, access, and minimal disruption. Ashley, what do you think is so important about tailoring the way you have a conversation with the people that are in the room?
Yeah, I mean, fact finding is certainly going to be important as we discuss, and then just knowing who you're talking to and just making sure that you're putting their concerns at ease. I think one thing that we do a fantastic job of is the support of this program, the rollout to employees, making sure that the employees understand the health insurance because health insurance is complicated. And we want to design plans that are rich benefits to employees, but then also user friendly. And we'll help support them at open enrollment. And then throughout the year, too, if they have questions or need additional education on the plan, that's one thing that our team is willing to do, in addition to helping support the executive team, the HR leaders, just on an ongoing basis and making sure this plan runs well. And then also just talking about financially how this plan is working. And that's one thing, obviously, the executives are going to be concerned. Is this showing savings? So through our detailed reporting, this is something that we can provide to employers too that's very attractive, where they have a look under the hood. They can see and track savings, where utilization is coming from. So that's been something that's certainly been attractive to our existing clients as well.
Yeah, great points, Ashley. Like it's really important to take stock of who's in the room, make sure you're speaking the language they want to hear, because every audience wants to feel comfortable with this new solution they're bringing in, and make sure that they feel comfortable in controlling what they're responsible for at that organizational level. And then one last tip we're going to leave you with here today is be a consultant, not a commodity broker. And what's the difference, right? Commodity brokers are delivering quotes, they're reacting to rate increases, they're pretty cut and dry. Whereas a consultant and a lot of the brokers that we work well with are providing education, they're, creating custom strategies. They're really coming in with a clear roadmap for cost control because employers are scared. They're seeing the reports, they're seeing, this is the highest rate increase in 15 years. They need someone who's going to kind of lead them and guide them in the right direction. So how can you do that? I mean, you can show your value obviously by showing up with data and benchmarking, making sure that you have actual results that we can prove here for them. Offering innovative plan design options, so not just off the shelf solutions. And then, of course, we've seen a lot of success when brokers frame their role as an extension of the leadership team. Like, we're all in this together. We're here to work towards finding the best solution for your team and your employees. And Josh, just curious, your thoughts on this and why it's so important.
Yeah, I think it's a great point. Brokers are extension of their clients, and we hope that you can think of us as an extension of your support that you provide. So think of us like that. And I'll say, you can put us on a spreadsheet and you can compare us to the as-is plans or the watering down of a deductible. And you do need to see those monetary comparisons. But I'd say we want to consult you. We ultimately want to help you consult your client. So, bring us in, and it starts at the quoting process, the exhibit development. We'll get you comfortable with the strategy, and then we love to help you and get in front of your clients and really show the value here and the support and the long-term strategy that we can bring.
Yeah, agreed, Josh, agreed. All right, so next steps. What can you take away from this conversation today? The first thing I want to make sure you guys have is access to our 2026 broker playbook. So we're going to send around the slides. You'll be able to click the link and download it here. We will also include it in the follow-up email, and I'll drop it in the chat as well. But this is just kind of a detailed guide of things that we recommend. It's very similar to the presentation today, but we want to make sure you have a takeaway, a white paper, if you will, to refer to over the next couple of months. And then, Ashley, I know we had someone in the chat asking, what's a good fit? How do we know when the MERP is going to work well? Would you want to speak to that?
Sure. And we're really in that mid-market space, 25 upwards of 1,000. If a group is fully insured or level funded today, that's a great solution. Great fit for us just on the MERP solution. If they have really rich benefits today, so a nonprofit municipality, we're able to drive more cost savings as they're paying traditionally a higher premium. So we are certainly a good fit for some of those groups that are in platinum or gold plans today. And then we have a lot of employers, as we talked about today, coming to us with difficult medical renewals looking for solutions. But then really the past couple of years, we've also pivoted to helping improve benefits for employers. And we can actually do a combination of both. So I think that's one thing that really makes us unique in that small group to mid-market space, where we can create these custom plan designs for employers to help attract and retain employees.
So most importantly, how do we get started? Don't think that it's too late here to finish out the year with maybe a tough 11-1, Kevin. Talking to you, if that 11-1 is, you got time to send that over to us, please do. We'd love to quote that one. 11-1, 12-1s. We're still in the midst of helping our clients here towards the tail end of 2025. But, as October approaches next month, most of those 1-1 of 26 renewals are going to be on your desk, and we'd love to help. So that's really what we'll need, the information contained in the renewal packet. Rates, plan designs that they offer currently today, tier counts, and then ultimately those alternate plans that we'll move them to. Like Ashley mentioned earlier, we blanket the country. We know the markets, we know the carriers, we know the plan designs in general that are going to work best. So if you don't have those yet, it's not too early to get started. So I'd say those renewals, any prospects that you may have. So a prospecting group that you're looking at, you don't contain all of this information. Well, what do you have? What do you know? And you know the size of the group, the carrier, what industry they're in. Call us, contact your sales rep if you know who they are. If you don't, you can contact us at sales@differencecard.com, and we'll get you connected quickly. But we can quote this stuff pretty easy. It's all going to come from the information contained from the carrier. We'll strategize with you quickly. We'll send it up to our underwriting team, and in busy season, sometimes it's 2 to 4 days to get a quote back, but it'll be solidified. It'll have the reinsurance stamp on it, and we'll be ready to bring you up to speed on it. But then hopefully, ultimately, propose this to the client. So any group, like Ashley said, mid-market, got rich benefits, or facing a tough renewal, fully insured or level funded, we'd love to help you and love to take a look. So please reach out.
Yeah, great, Josh. Thank you. This has all been super helpful. I'm just answering a couple of questions in the chat here. One came through from who was this? Melissa, sorry, Madison, you were looking for some case studies. You had requested maybe 3 to 5 case studies with different size groups that you can use in an initial meeting with a client. 100% agree. I just dropped a link into the Difference Card website. You see it, that has all of our case studies. Every month we highlight a new win. And so we cover every region, every industry, every group size. If you can't find an example there, please email me, because we've got years of them up there, but I think this will work for what you're looking for. And then switching gears, we did have a question. Josh and Ashley, Peter's wondering, do we have industry benchmarking? Is there anything we could provide on that?
Yeah, that's we certainly gravitate to different types of industry. We have clients that are in really every industry. And I think the specific question is, within a specific industry, what type of benefit is being provided? And I know there's a number of external resources that you go out and you can pull that based on SIC code, based on zip code. If you come to us with a particular client in a particular market, yeah, we can definitely go back to our book of business and say, in nonprofits in this particular market, we're seeing that these plans are really popular in manufacturing and healthcare. Kind of across the board, we can help have those strategic conversations. It really starts with, what's the starting point? What do they provide today? What do they want to maintain, and what type of results do we need? And we can strategize from there.
Yeah, with our book of business, we can also, if you're targeting nonprofits, for example, we can pull stats on what are the average savings, total percentage, dollar amounts, how many clients do we have? So we've had a lot of success putting those stats together if you have a certain vertical that you're attacking, to provide you the backup that yes, this solution does work, and it's a great way to save money off the employer's healthcare spend while keeping benefits intact.
Yeah, agreed, Ashley. We've got 20 years of utilization data and stats, and we're happy to configure them however you might need it. Question here, Ashley, you were speaking a little bit earlier about the difference guarantee, and I know we didn't spend too much time going into how that works, but we do have someone who said they currently have a difference card MERP plan. They love it. It works great, but they are interested in maybe just a little bit more information about the cap on funding and how we're able to do that.
Sure. And we can always add this to existing clients if it does make sense. So we can connect you with the appropriate person on the team to have that conversation. But that difference guarantee is a great solution where we will give you a maximum claims number. We'll be able to go through what the guaranteed savings are. So for those of you who are out there prospecting, that's been a great solution to go out to an employer and say, hey, versus looking at your current increase, here's your worst case scenario with this type of funding solution.
Yep, agreed. It's pretty cool the way that we can make sure that we're hitting that risk tolerance for everybody. And then final question here from Mark. What is an ideal group size? What does this work best for?
Well, we can write the reinsurance down to 10 lives. I think our average is right around 100. We have really large clients. I'd say it kind of goes back to what do they provide today? How much premium decrease can we get from that client? And that's easily determined. And then we go from there. But yeah, mid-market, fully insured, level funded, relatively rich benefit plans in place today. Any one of those categories that group may fall into, we should be able to show you some pretty good results.
Yeah, agreed, Josh. Okay, and I lied. I said that was our final question, but I got one more because I
coming.
think this one's really important for everyone to hear. A different Mark is wanting to know, is there broker compensation?
Oh yeah, absolutely. So we want to keep you whole, right? If you're reducing premium and your commissions are tied to carrier premium, well, we can build out a PEPM broker compensation on on the admin side of the difference card. So that's part of the strategy that we'll have, and we'll certainly discuss that as we're in the quoting process and lay it all out for you on a case-by-case basis.
And those financial proposals that Josh and I went through, those are net of difference card service premium, broker commission. So it's all a true net cost that we're showing to the client.
Great point, Ashley. All right, well, we're at time. I did just drop a link into the chat. If you are not familiar with maybe who your difference card rep is, this is a map. If you hover over your state, it'll show you who is serving your territory. It'll have their email address and phone number so you can reach out to them. You also are welcome to submit any questions through sales@differencecard.com. We man that inbox. We will get back to you. And then you can request a quote online. So if you go to differencecard.com and click request a proposal, fill in just a couple pieces of information, we will have someone get back with you, usually within 24 hours, and get a quote worked up for you. Thank you everyone for joining us in this very, very busy time of year. We appreciate you being here. I hope you were able to learn something, and I hope we're able to tackle this really difficult renewal season together. And thank you, Josh and Ashley. Appreciate all of your insights today.
Thanks, everyone.
Thanks, everybody.